The stroke unit at the Vale is here to provide specialist stroke rehabilitation for the county. The unit consists of all single rooms, and they're spacious, and each room has its own ensuite bathroom. It's providing that right environment for rehabilitation. Patients come here normally directly from Gloucestershire Royal Hospital, where the patient's stroke journey starts. Having initially had their stroke, they're taken to the acute unit, they spend some time there, and when they're medically stable and ready for ongoing rehabilitation, they can be referred to our unit here. It's important that patients feel welcome as soon as they arrive and they settle into the environment that we provide for them.
9 weeks ago I had a stroke. I was at Gloucestershire Royal and came down here 4 weeks ago. When I arrived down here, I couldn't walk. My speech was very slurry and I couldn't move my arm. But now I can move my arm and I can walk fully independently.
Patients will come here with active rehabilitation goals in order to progress into the next stage of their recovery. Their goals are discussed with them, families who are involved with them. The goals are realistic and achievable. The facility here maximises their potential for recovery, so we provide physiotherapy, occupational therapy, speech and language therapy, psychology. There's the full range of a multidisciplinary team here. The nurses, the doctors, and we have rehabilitation assistants. The pharmacists and dietitians are also specialists in the area of stroke. Patients like getting to know staff particularly, and they tend to have the same therapists follow them through from the beginning to the end of their stay here.
The staff are brilliant and you're seeing the same people all the time, so build up a rapport with them. And I have physiotherapy, speech therapy and OT, occupational therapy.
We try to adopt a 24-hour approach to therapy, so in between therapy sessions patients are enabled to practice exercises as much as possible, to keep active. We have a lot of groups going on, so we have art therapy, we have a garden group, we have speech and language groups, and volunteers that come in who are befrienders and will talk to patients. So there's quite a lot of social interaction that goes on as well. The consultants at Gloucestershire Royal visit the unit here once a week and are able to review patients with us as well. And we have the doctors who are on the ward on a daily basis here to cover any medical issues as they arise. Most of our patients have gone home from here to their own environments. The early supported discharge team take over and continue their rehabilitation in their home environment.
10 out of 10. I just can't fault any of them.